All right, let's talk a little bit about sickle cell anemia. So there's a point mutation on the beta globin gene, and there's a single acid immunosubstitution from glutamic acid to valine. And this alters the hydrophobic reactions on the beta globin chain, and that causes the aggregation of hemoglobin, and that causes extravascular and intravascular hemolysis. Okay, so we're going to see some complications. Autosplenectomy, that's going to be their Howell-Joel bodies. The risk of infection will go up by things like salmonella, like osteomyelitis. And we're also going to have some painful vaso-occlusive crises like dactylitis, painful swelling of the hands and the feet, priapism, acute chest syndrome like respiratory distress, and also sickling in the renal medulla. And you can treat it with hydroxyurea, increasing HbF, and hydration. So here we have swollen, painful extremities in an African-American infant, dactylitis from sickle cell, microvascular occlusion, hemolysis, decreased haptoglobin. So here we have just like a 1-year-old African-American baby boy, painful, swollen hands and feet, dactylitis, and a family history, as well of pneumococcal sepsis. So that suggests asplenia. So we think sickle cell, it's autosomal recessive, decreased haptoglobin. And so here we have our question stem, bilateral hand-foot swelling. What are we going to see? Decreased haptoglobin. So in sickle cell, the sickled red blood cells will rupture, and that releases the hemoglobin, and the haptoglobin binds to this free hemoglobin. So as it gets used up, the serum haptoglobin goes down. So here, serum haptoglobin loves binding to that free hemoglobin. And so let's look at some trap answers. Decreased cardiac output. So in SCD, patients would develop high output heart failure, but not in infancy. So you're not going to see that at this stage. It'll be preserved. Low serum albumin. That's not going to be seen here. It only drops in kidney and liver diseases. C1 esterase inhibitor deficiency, that's hereditary angioedema. And so that would cause painless swelling in the face and lips, no fever and tenderness. Increase systemic venous pressure. That would occur in the right-sided heart failure. And this baby's issue is microvascular infarction. So it would be the fluid overload. Increased urine cortisol excretion. That would be seen in Cushing's or in stress. And so here with our sickle recap, basically what we need to think is the sickling of the red blood cells and the hemolysis, which then that hemolysis causes decreased haptoglobin, and then increased LDH and increased indirect bilirubin. And also you see the splenic infarction, and that's because of the functional asplenia. So that's going to have you experience an increased risk of infections. Other than that, that's pretty much the basic lowdown on sickle cell anemia. And yeah, if that was helpful, like and subscribe.